Good morning or good afternoon, everyone. Welcome to today's webinar hosted by Hep B United. My name is Kate Morales. I am the Deputy Director of Public Health at the Hepatitis B Foundation and Director at of Hep B United. We are a national coalition co-chaired by the Hepatitis B Foundation and the Association of Asian Pacific Community Health Organizations. So we're really pleased to present today's webinar, and happy Pride, everyone. This month, we're highlighting the impact of hepatitis B on LGBTQ communities. Today's panelists will share efforts to raise awareness about hepatitis B, efforts to improve testing and vaccination, specifically among the MSM Latinx community in King County, Washington State. And then we'll also have CDC, Division of Viral Hepatitis, sharing resources to promote hepatitis A and B vaccination among MSM communities. Before we get started, just to remind everyone of today's logistics and how you can participate, all attendees are in listen-only mode. If you encounter any technical difficulties online with computer audio, please dial in using the phone option on your control panel. And the conference line, at least for the US-based attendees, are shown here. Also, if you have any questions, please feel free to enter the questions into the question box, and we will be addressing them at the conclusion of all the presentations. Additionally, if you have any technical challenges, please do indicate your issue using the question box as well. All right, before we get started, our speakers today would be interested to know if organizations or attendees that are joining us today are also implementing a hepatitis B program to increase awareness, testing, and or vaccination among LGBTQ communities. I'm going to pull up the poll now. You could take a moment, let us know if you are currently implementing a program, or if not, it'd be great to know. I'm going to give it a few moments, give everyone time to respond. All right, final call. Great, I'm gonna close the poll. And then let's take a look. All right, wow. It looks like a little more, a majority are not, but we have a really good percentage that do have programs, hepatitis B awareness testing and or vaccination programs being implemented around the country. If yes, we would greatly appreciate it if you could share just a few details of the types of programs that you are implementing. If you could enter them into the question box, I will share it with everyone out loud. Is it an awareness education program? Are you doing testing? Or are you doing vaccination, or all three? Anything you'd like to share would be great. I'll give it a minute and see if we get any responses. Great, thank you. We see someone who's joining as a student who's studying currently. Someone has shared that at Project Weber, they do vaccinations, right? All right, feel free to keep them coming. I'm going to go ahead and introduce our speakers. So today we're going to start off with the King County program, and our speakers who will be sharing that effort are Anthony Lee, who is the Hepatitis B program coordinator at the Hepatitis Education Project in Seattle, Washington, along with Lester Munguia, who is the HIV Prevention and Community Outreach Specialist at Intermanus. And then we will wrap up with Amanda Carnes, who is with the Division of Viral Hepatitis at the Centers for Disease Control and Prevention. Great. And then before we get started, I'm just sharing one more person to share that they are doing education screening and linkage to care in that community. So thank you all for participating in the poll and sharing the work that you guys do. All right, so I am now going to turn it over to Anthony and Lester.
Hi, everyone. This is Anthony speaking. Thanks for joining us today. Enjoy the presentation.
Hi, everyone. I'm Lester, the HIV Prevention and Outreach Specialist, and I'm pretty excited to talk about this project that Intermanus has with Hepatitis Education Project.
Okay, could you go to the next slide, please? To begin, I'd like to introduce the Hepatitis Education Project to everybody. If you didn't already know who we are, we work in the Seattle, King County area, providing services for hepatitis B, A, and C as well. In my position, I do a lot of the testing and vaccination outreach in disproportionately impacted communities around Seattle. Through our work as well, we empower and build up the capacity of other community organizations so that we can increase our testing awareness and outreach range. And lastly, we're part of the local and national and global efforts to advocate for hepatitis all around the world. And at the bottom of the screen, you can also see a lot of other services and prevention and education events that we have. We also are running a STEP clinic to provide low barrier access to for opioid use disorder patients as well. And yeah, I'm excited to share more about the work we're doing in hepatitis B with everybody. I'll hand it over to Lester.
Next slide. So yeah, we also work at Intermanus in King County area. My work at Intermanus consists of coordinating the HIV and STI testing program, also organize and coordinate educational community events to engage Latinx LGBTQ community, and also do online outreach through Intermanus social media platforms and collaborate with researchers, and also produce the radio podcast show that we are going to be talking about further. Intermanus is the mission is to promote the health and well-being of the Latino, gay, lesbian, bisexual, transgender, and questioning community in a culturally appropriate environment through disease prevention, education, support services, advocacy, community building. One of the main services that we offer, you can see the health sphere, HIV and STI testing. We provide confidential testing and referral services to our current address. And we also provide rapid HIV testing at health fairs, community events, pride activities, Latin American consulates, and other places. And right now, due to the COVID-19, Intermanus is only offering testing at the office and just by appointment only on Tuesdays. So We are taking really serious the COVID-19 screening, so we used all the PPE necessary to do the test. We have also a PrEP navigation program. It's important to say that 95% of our clients are Latinos, 75% of them are immigrants, 80% of them are clients low income and with no health insurance. So that's why we have a PrEP navigator that help these folks with access to HIV prevention strategy like PrEP. We also have condom distribution among restaurants and Latino hubs like nightclubs, case management for Latinos living with HIV, support group, and below you can see other services that we offer. We are recently have like 2 years working with immigration, legal services, workers' rights, and social activities for our Latino community. Next slide.
And so I'd like to introduce everyone to this project. First, by going over some of the findings I found in the literature review. The gist of this project came from an application to last year's Hep B United mini grants application process. And so through this grant process, I found a lot of information about the MSM community and hepatitis B. And I found a lot of information on the Latinx community and hepatitis B, but there was no real overlap in the studies that I found that specifically looked at Latinx and MSM communities. And so to begin, I'd like to share some statistics with you about hepatitis B in the MSM communities, and more specifically in Seattle. If you look at the first point here, you see that about 40% of MSM have been exposed to Hep B, and only 27% had immunization coverage. And this was from a study I found of the Young Men's Survey Study Group in 2001. And so the caveat to this study was that a majority of participants were actually white and middle class. And so we assume that these numbers and statistics are lower for minority communities. Moving on, we see that even though about 90% of the people in the survey reported regular access to health care, only 10% had been immunized, although 2/3 of people had been tested for HIV infection. And so we see here that there is a lack of provider awareness about the rates of hepatitis B in the MSM community. And so from this, I learned that HIV testing presents a great opportunity to educate and vaccinate for hepatitis B due to the similarities in the way both viruses are transmitted. And because hepatitis B is so less known within the community, we could include that as part of STD and HIV testing. Kate, could you press the slide, please? And so information on hepatitis B in the Latinx community was a little more difficult for me to come across. In a population-based household survey that I found that explored the distribution of hepatitis B exposure and infection in US Hispanic adults, found that the prevalence rate of immunity for both men and women within the Latinx community was fairly low. And the study also found that adults from the Latinx community had the lowest rates of Hep B vaccine, regardless of risk behaviors. And another study that I found from the US REACH study, the Latinx community was actually less likely to be tested for Hep B compared to any other racial group. And the Latinx community also has very high rates of chronic liver disease and cirrhosis, higher than those compared to their white counterparts. Next. And so now Lester and I would like to share some of the work that we've been doing with you to address education and awareness in a culturally sensitive manner to the clients that enter Hermanos. And I'll let Lester take over.
So throughout the last 2 years, we have increased our Intermanos and diversify our audiences in our social media platforms. We have been building and managing online communications for Intermanos in an effort to reach out more to our community. We have increased online engagement through Facebook and Instagram, posting information related to hepatitis B and how to access testing and vaccination. On the left, you can see one of the samples of our graphics that we are using in Spanish in our social media platforms. And it has been a really good way or strategy to reach out people in social media. We have also we have a radio show and podcast. It's called Mucho Gusto. It's a Spanish radio show and podcast hosted by La Gordis. She's a Latinx drag queen icon, and this show is produced by me. Is sponsored by Washington State Department of Health, and is pre-recorded and transmitted every Sunday through different radio and podcast platforms. In the hour-long program, we inform our community about services that we offer, health news, prevention tactics such as HIV testing, hepatitis B testing and vaccination, PrEP medication, and every week we have a special guest, a community liaison that speak about programs, policies, news, events that are happening in the Latino community. And traditionally, this show has been a key source to informate the monolingual Latinx folks because it breaks the barriers of literacy, and also it is easily accessible. On the right, you can see one of the community events that we have held, and I organize community forums for our Latino community, and I had the opportunity to have Anthony in our recent community forum as a speaker and presenting to some of our community members about hepatitis B awareness. Next slide. So you can see here some numbers about how we reach our Latinx community. So in average, approximately 4,000 people are reached through the radio. 1360 AM, the El Rey is called this radio station, and 4,000 people per week is approximately reached. 2,500 people is reached through the radio 99.3 FM every week. 95 people is reached through podcasts every week. That's an average. And the community forum that we had recently with Anthony, 15 people attended. 325 people have been reached through Facebook and Instagram posts. And this is just like the beginning or the start of the post that we have had in the social media platforms. And 80 people is reached every week through Facebook and Instagram stories. And Anthony, if you can talk about the referrals that we have had so far.
Yeah, thanks, Lester. So for those of you who don't know, Intermanus and the Hepatitis Education Project actually share the same building. And so we are right across the hall from each other, which makes referrals and testing and vaccination fairly simple. Many times Lester or like Ordis will bring someone over from their HIV suite that they have done at Intermanus to the Hepatitis Education Project, and will go over risk factors for Hep B and C and do testing and vaccination where we feel appropriate. Through this, Lester has spoken and educated people on hepatitis B, and he's reached about 74 people Of those 74 that he's spoken to, we have tested 9 for hepatitis B, with either Lester or LaGuardia translating or interpreting for us. And of these 9 people, 3 of them received at least 1 dose of the hepatitis B vaccine. And so we had just begun working on the referral process right as COVID interrupted our services. And so we're hoping that once HEP can get our testing back up and people are moving around again, we'll resume services. Kate, could you move on to the next slide? So we wanted to share with everyone some of the media outreach and how it looks. At the bottom left, you can see that we created flyers and little sheets for Lester to slip into educational materials as well. You see at the very top that Lester had created a very cool social media engagement with their Instagram and Facebook stories. At the bottom right, you can see LaGuardia, and I'll let Lester talk more about the radio show.
Yeah, so the radio show, if you can see, there is a link over there. If you can, if you wanna listen to the most recent programs that we have, we post the link for the podcast every week, and that's the link. We reach a lot of people every week, so that we are glad that we have this kind of tool to promote our services and also health services like hepatitis education project. And you can see LaGuardia. She has been one of the most famous Latinx drag icons in the Seattle area. And we are glad that we have this character in our office working as a prep navigator and also the host for the radio show that we do every week. And we share the same building as Anthony says, so we are really close each other. And definitely the COVID-19 lockdown has really impacted us with the services that we offer. So we haven't closed our doors for HIV testing. We are doing it on Thursdays and Fridays and just by appointment only. Of course, the amount of people or the demand has been really low during the last three months. So, but we are still working to improve our services in the next months.
Next slide, please.
Next slide.
And so I just wanted to share some of the citations and information about HEP and Intermanus. So if you're interested to learn more about our organizations, you can reach out to Lester or I, or visit our websites. Thank you for listening.
Yeah, thank you so much. You can reach out to me at lester@intermanus.org, or you can see or check our website. We are welcome to talk more about this project with you guys if you are interested.
Great. Thank you so much, Anthony and Lester. There are some very cool graphics that you all have created for this project. And look forward to hopefully getting that up and running after we get back to some sort of normal state after COVID. So now I'm going to turn it over to Amanda Carnes, who will be sharing some communication materials from the CDC.
Hi, everyone. Thank you so much for the opportunity to join the webinar today. I'm going to go briefly over just some of the materials we have for gay and bisexual men on the DVH website. So as Kate said, I work on the education, training, and communications team at DVH. Yeah, go ahead, Kate, it's fine. So last year, actually in 2018, we started a project where we were looking to do some formative research to develop some materials encouraging hepatitis A and B vaccination in gay and bisexual men. We haven't had a lot of materials on our website before. We had a fact sheet that was several years old and some other content, but nothing that was updated and nothing that specifically looked at vaccination efforts. Like I said, we started the project in 2018 by conducting some formative research with some lit reviews, looking at A and B vaccination in this population, and also looking at perceived barriers, stigma associated with hepatitis, and just some general knowledge and awareness of A and B in this population and the providers who serve this population. We also did some key informant interviews with a subset of men and also some key stakeholders who work for some organizations across the country who serve gay and bisexual men. And from that research, we developed some materials encouraging vaccination. We have a consumer website that is short and sweet and has an overview of hepatitis A and B. We also developed some posters which have an area for localization on the bottom. So different organizations can put in their location and times of services or vaccine programs. And then we also offer a variety of digital tools. Next slide. So here's a glimpse of what the website looks like right now. We've added some imagery for Pride, and this is just the website that has a brief overview of A and B and kind of highlights the importance of vaccination. We also link to the vaccine finder that HHS has that you can actually plug in your zip code and find vaccination services near you. Next slide. This is also another website that we have for healthcare providers and service providers. Material here is outlining the actual recommendations, the scientific guidelines and recommendations CDC has released for A, B, and C, and the specific recommendations for this population. Next. On this same website, this is where you'll find some of our resources. So here you can see posters. We also have digital tools. Next slide. Here's another view of the posters. And as you can see at the bottom of the screen, the white banner actually has a place where if you open this in the PDF, you can actually insert your logo and type in text. So it's not just something you can write. You don't have to write with a marker. You can actually input it into the PDF and have it printed that way. Next slide. Here's the digital tool. So we really designed these so that you could use these on if you ever do digital ad buys on dating apps or on your website as buttons or banners. And then we also have used them on social media as well. Next slide. So kind of going in on a bigger scale, as many of you are aware, there are outbreaks across the country of hepatitis A in gay and bisexual men, and then also in people who use drugs and people experiencing homelessness. So I did want to take a moment to highlight the hepatitis A outbreak website. There's a variety of resources there. There's fact sheets, pocket cards, symptom cards, and also different websites and things not only for consumers, but also providers. Next slide. And here's just a variety of the materials that we have that are outbreak specific that are for targeting gay and bisexual men. Next slide. I also wanted to briefly talk about, we actually had an opportunity this year that we were really excited about to do a digital ad buy through the Gay Ad Network, which manages a variety of websites, dating apps, etc., that solely target members of the LGBTQ community. So we worked with the Gay Ad Network to acquire placements on a variety of websites and platforms that target gay and bisexual men so that we could ensure our messaging was reaching the target population. And so this is, again, the hepatitis A and hepatitis B vaccine message. And as you can see on some of the images here, we provided creative that was used both as banner and then also as ads on the side and on the top of different websites. Next slide. We also, through the Gay Ad Network, worked with them to get our ads on mobile platforms as well. So you can see there's mobile banners, and then there's also interstitial ads. So these are the ads that you see when you're looking at content, and all of a sudden an ad pops up and you actually have to click out of it. We also did some of that advertising as well. Next slide. So I just wanted to end briefly with sort of a question, and Kate, we can either have people put this in the chat box, or I'm also happy if you would like to touch base with me anytime after this webinar. I include my email on the next slide. But one of the questions I had is, what communication or education resources are needed for consumers and providers to help encourage vaccination and testing in gay and bisexual men in the LGBTQ plus community? I think, like I said, we realize there's a gap in materials from CDC, and we just want to know and talk to community members what's needed and maybe how we can address some of those needs with communication materials. So thank you.
Great, thanks, Amanda. Yeah, if anyone wants to respond now and provide your feedback to this question, what communication or education resources are needed, please feel free to send them into the question box. It would be great to hear from folks in attendance today. And I'm going to see if we have any responses, Amanda. So one person says resources for people over 40.
Okay.
Yeah, I just wanted to clarify to that person who's asking. Did you have a follow-up question, Amanda?
No, I was going to ask the question to clarify, but yeah.
Yeah, could you be more specific? If you could provide more specifics, is it in the specifically in gay and bisexual men or LGBTQ plus communities, those over 40? And then we also have, are there any materials for trans women and men?
Unfortunately, CDC doesn't offer any. I know there are a lot of organizations that have, great materials out there, but from CDC right now, we don't. I think that is something that we've been discussing. So it is on the list. It's just not something we have right now.
Getting a few more responses here. Are there any resources for provider offices as there are for cancer?
We do have the website that I showed in the earlier slides that outlines the different recommendations and links to the scientific guidelines. But as far as that's really the breadth of the provider resources we currently have. I would be open to hearing kind of like specifics as far as are they thinking kind of like cheat sheets or kind of webinars or anything like that we should have for providers that would be better meet that need.
And then a clarification to the earlier question. Do you have resources for people over 40 in the LGBT community, more faces of folks that are in that age category?
Gotcha. So on the website that we have that I mentioned earlier in the slides for gay and bisexual men, we do offer another set of posters that has an older I don't really know the age of the individuals, but I think they do look older than some of the other options we provide. So we did try to provide a variety of age demographic, but that is something, obviously we can take note of and see if we can expand that as well.
Great. Yeah. And then the clarification on the provider resources, the person is asking, clarifying, they were thinking Q&A formats possibly, or an FAQ would be helpful.
Yes, that is helpful. We actually have Q&As on our website, and so I will jot that down now that that's something that we need to make sure that we're addressing specifically with this population. So thank you.
Sure. And then also a suggestion for ads on buses and public transportation. So then using that as a channel. And this is something that was done for Hep C in Baltimore County, Maryland.
Absolutely. I think, you know, right now we have such a limited budget, it's, you know, digital is very easy to hyper target and make sure that, you know, the message is getting to, you know, the appropriate, you know, target audience. So I think we started with digital, but I think the more and more we do have resources developed in content, that we can definitely expand beyond digital to that more traditional out of home placements.
And then a comment about non-binary communities. There's a need to produce materials for trans communities. Non-binary communities are often forgotten, even though they may also be at risk or need vaccines. And gender non-conforming communities.
Absolutely.
Right. So we do have some questions which are also intermixed in here, and I will give it another moment to see if there are any other suggestions for communication or education specific resources. Okay. Great. So feel free to continue sending those in. We do have time for questions, so related to the presentation. So please continue to submit them into the question box, and we will address them. Looking back through the questions, Anthony and Lester, there was a question for you related to the study in Seattle that you had referenced, and a clarification. Is it 27% of the 40% that have coverage, or 20% of all MSM?
Yeah, thanks for the question. Let me bring up 20% of, yeah, 27% of all that were in this survey. I apologize for the wording, but yeah, 27% of all that were surveyed had immunization coverage, I believe. Looking back at my notes, I can also send me an email, and I can also double check for you as well.
Thank you. All right. And I think this is also for you. How do you fund the free Hep A and B vaccines as well as the testing?
So we are funded partly in the Hep B program through a grant from the Molina Healthcare. We wrote a grant to provide wider services to a wider community that are disproportionately impacted by Hep B in Seattle. And so through that, we're able to pay for some of the testing and outreach supplies. We also receive funding from Gilead Sciences as well for hepatitis B testing, and I believe our hepatitis A and B vaccines come from the Department of Health here in Washington.
Thank you. And then this, I think, for Lester, is there a way others can listen in on the podcast? Is there an app?
Yes, so you can find us on Facebook as Mucho Gusto Radio. We are also on Instagram, and you can check there the link for the app. I use Anchor FM, but you can choose like 8 other different apps to listen to the podcast. One of the most popular are Anchor, Spotify, Apple Podcasts, Google Podcast. Those are the main ones that I've seen that people use to listen to the podcast. But yeah, there are, if you check the link that was in the presentation, Anchor FM/Entre you will find like 8 different ways to listen to the podcast.
Yeah, Lester, if you are able to put that into the chat box to everyone. If not, no worries. I will also share it in the follow-up email with all attendees too.
Okay. All right.
Great. And a question for you, Amanda, for CDC. So this question is addressing that HIV and viral hepatitis funding from CDC is coming from 2 different sources and are often siloed. It's difficult for funding from the Division of Viral Hepatitis often can't be used to purchase vaccine. And I guess that also is coming from another division. So it's very difficult for jurisdictions to promote integrated services that provide HIV prevention and hepatitis A and B vaccination under one roof. And it's great to link people to vaccination at their healthcare provider if they have one they trust and they have adequate insurance coverage. But the need is for vaccination access in high impact settings that serve gay and bisexual men, as well as people who inject drugs, who may not be comfortable accessing services in a regular healthcare clinic. And I guess sort of the project that Anthony and Lester have accessing vaccines through there. Do you have any suggestions or thoughts on how we can address this gap?
That's a very good question, and then one that we get not frequently, but definitely enough. I mean, I think I am obviously just on the communications team, so I don't necessarily work on the programmatic side of things. I hear the question and understand it. I mean, I think, Anthony and Lester are doing a great job at providing services in, the types of settings they reference. And so I think learning from people who are doing it in real time and, getting the vaccines from different, through different mechanisms. I definitely think it would be something that I could follow up on. And Kate, at the end of my slides is my email, but I'm happy to have my email sent out through everyone. And if you would like to send me, this question, I can connect you with someone who could probably better answer the question and get you more information. But something I definitely think we should continue to talk about. And I think, different states that might be more integrated, that the HIV and the hepatitis programs might be more integrated, might be something that we could look to as well to see how they do this. But I know it's a complicated issue.
Yeah. Thanks, Amanda. And I pulled up Amanda's email right here if you'd like to reach out to her directly. And then another question for you. So all the CDC materials are focused on hepatitis A and B vaccination. Are there plans or resources to also develop materials that are focused on hepatitis testing, specifically for gay and bisexual men?
Yes, I think, obviously, I think that's a little bit down the road, but that is on the list. Right now we've been working on our No More Hepatitis campaign, which encourages hepatitis C testing in all adults. But, we have a list of priority populations, and MSM being one of them, and not just C, but also for hepatitis B. So those are on the list and in the works. But if you would like to reach out to me and have any suggestions on specific materials or requests that you have, I'm always happy to take those and see what I can do as far as, expediting some of the things that are on our list.
Thank you. And then for Anthony and Lester, I know that you had mentioned COVID-19 kind of put a pause on the program while you were just sort of implementing the referral, testing, and vaccination services. Are there any other challenges in terms of referral from Intermanus to the Hep Education Project to conduct testing and vaccination that you encountered? Were there any hesitation? I know that you had tested 9 people and were able to complete 1 dose for a certain number of people. Were there any hesitation in getting the Hep B test or vaccination? Any other challenges at all that you wanted to share?
Yeah, so Intermanos right now is just only offering HIV testing by appointment only on Tuesdays and sometimes on Fridays. So it has been really, we have really reduced the amount of time for testing at Intermanos, and we are not doing like outreach testing in other places. So that's has been impacted us because mainly all the like 3/4 of the amount of tests that we have done since the beginning of this year has been before the COVID-19 lockdown. So and it has been really difficult so far at Intermanos. We had just like 1 or 2 people signing for an HIV testing every week, and that has like really impacted us because we cannot offer other services that Intermanos also have. And also the Hepatitis Education Project has reduced the amount of hours to do testing. So that has been like impacted us to like do referrals and do hepatitis B testing and vaccination.
Yeah, that's we've reduced a lot of our testing capacity for the moment, and our vaccinations are currently for walk-ups and clients on our Hep C case management program. Another difficulty I remember before COVID happened was we would have people call the Hep phone line and only speak Spanish. It happened a lot, especially after appearing on the podcast. And even though Hep has an interpreter's phone service, we've learned since then from working with Lester and working with the OL that a lot of their clients do not enjoy or do not open up as much when they had to interpret through the phone. And so we are trying to figure out ways to interpret and have culturally sensitive care for clients who come in without being escorted over from Intermanos.
Mm-hmm.
Thank you. That makes sense. Great. And a question about, so you had mentioned you were able to, before COVID, provide the first dose of the Hep B vaccine, Anthony. Was there follow-up to complete the series, whether it was either the 2 or 3 dose?
Yeah, so we at the moment are doing, we only have the 3-dose Twinrix. And so everyone that has a vaccination from us walks away with a timeline on when they should come back. And I also have, as part of my workflow, outreach to these individuals who, as the time comes, I will send them reminder emails to come visit us and to have another dose of Hep B. Since COVID, we haven't done that. We've reduced our program so much to the point that we are just taking care of our STEP clinics, which is our low barrier buprenorphine clinic, our syringe service program, as well as our corrections program. And so we hope to see more referrals and more people show up for Hep B vaccines as the restrictions are lifted.
Thank you. We definitely understand the challenges that many direct services, community organizations that are providing direct services are experiencing right now. Definitely something that a lot of folks are dealing with. So thank you for sharing. And I'm just going to check back to see if there are any other further questions that are coming in from the attendees. So feel free to submit any additional questions. There was a few questions that came in from outside of the US. So thank you so much for joining us. As far as access to free vaccinations or testing, I would definitely recommend reaching out to the World Hepatitis Alliance, who will be able to provide probably resources or organizations that are working in your country, in Ghana specifically, that may be able to partner with to provide hepatitis education. And if you reach out to us, we can also talk offline about partners that we have working in Ghana as well that can and work with you. And then Amanda, just another suggestion for placement of ads that came through. And this is a really interesting one. So movie theaters, which may not be open at the moment, but in the future, movie theaters or PSA ads, if you're thinking of developing PSAs in the future.
Yeah, that's a great suggestion. We've done that for some other campaigns, but yeah, maybe once things are open again. That's a great idea. Thank you.
Yeah. Great. Thank you so much. Well, I do not see any additional questions. So I'm going to go ahead and wrap up. If anyone thinks of any additional questions or feedback they'd like to provide on educational resources, please feel free to send an email at connect@happyunited.org, and we will share them with our panelists. And I wanted to thank everyone so much for taking the time to join the webinar today. We hope that today's webinar focusing on LGBT communities and the resources that are available to the community is helpful and is helping to increase awareness, particularly during this month as you're working in your local communities. And thank you so much to Amanda, Anthony, and Lester for sharing your work with us. We really appreciate it. And we hope everyone found today's webinar informative. And then before we close out, just a reminder to fill out a brief survey, which you will see right after this or following up tomorrow. And we will be able to share a recording of the webinar as well as a copy of the slide presentations within the next 6 or 7 days, as well as post it to our website. So feel free to share these resources with your partners. Well, thank you so much, everyone, for joining, and have a great rest of the day. Bye-bye.
Thank you so much.
Have a nice day.